Thank you all so much for being here. My name is Jack Corby. I'm the Vice President of Stevens Strategy. For those who are not familiar with us, we are a full service consulting firm. We help colleges, universities, and schools navigate strategic change. We're a mission driven firm. We have a team of 18 wonderful consultants, and you'll get to meet two of them here today with us. We have been in operation for about 25 years. We've had the privilege of partnering with more than 150 campuses across the country, helping them through governance, optimizing resources, academic reviews, and most notably strategic planning. Today marks the launch of our new webinar series, something we've been talking about internally for some time. These sessions are designed to let our incredible team and expert guests share their insights and engage in candid conversations around some of the most pressing issues facing higher ed today. Each month we'll focus on a different theme, but the format will remain the same. We'll do a short introduction like I'm doing right now. We'll give a little context on the issue we want to talk about, and then it'll be a fireside chat style discussion where letting our experts and guests dive in. To get us started today, I would like to introduce our wonderful guest. John Scaringe is the president and CEO of Southern California University of Health Sciences. John has been in this role since 2009. As we'll discuss further today, in 2015, he launched and planned for a 10-year turnaround for the institution. Over this time, SCU saw an increase in student enrollments by 125% and graduation rates by 50% increase. He's led an amazing institution and has had a lot of great successes. They've expanded significantly, most recently adding a master's of science in medical science. The university currently enrolls around 4,000 students, offering a range of programs from certificates to doctoral degrees, across its multiple campus operation. A chiropractor by trade and an avid Yankees fan, John holds an ED in educational leadership. And then in 2022, most recently, he was honored with the Visionary Award by the Academy of Integrative Health and Medicine for his outstanding leadership and commitment to the field of integrative health and medicine. John, thanks so much for being here. I really appreciate that.
Thank you. It's a pleasure, and I feel honored with our other two panelists here.
Awesome. And I will introduce those wonderful panelists right now. With us, we have Stevens Strategy Senior Consultants Bob the Kaufmacher and Catherine Dodge. Bob is an expert in higher education leadership, financial planning, and turnarounds. He served on the board of many higher educational institutions, many of which have led turnarounds and repositioning themselves. Most notably, Bob served on the board of Southern New Hampshire University when they decided to launch an online program that has turned into the behemoth that is today and notable across the industry and sector for its online education. Before that, he was the president of the Landing School, a boat-building school in Arundel, Maine, where he guided the institution to record enrollment levels and a re-accreditation with distinction. A graduate of Harvard Kennedy School of Government, Bob joined Stevens Strategy in 2006. He leads our firm's operational services and board management and turnarounds. Bob, thank you for being here.
Thank you, Jack. Great to see everybody. It's a pleasure to be with you all today.
Awesome. And last but certainly not least is Catherine Dodge. She's an expert in higher education accreditation and strategic planning. Catherine has had many roles and worn many hats across higher ed, most notably special assistant to the president at Keene State College, and most recently, she served for a decade as the state higher education executive officer, the New Hampshire Higher Education Commission, running the statewide accreditation efforts there. Catherine holds a PhD in human organizational systems. She joined Stevens Strategy in 2023. After 10 years of running her own advisory practice, she leads our firm's accreditation and large group facilitation efforts. Catherine, thank you for being here today.
Thanks, Jack.
Awesome. So to get us started, as I said, I really kind of want to cover and talk about what a turnaround is. Bob, I'd love if you could talk to us a little bit about your 8 tips for planning a successful turnaround and what you've learned from institutions that you've worked with. What goes right, what goes wrong? Talk to us a little bit about what a turnaround is.
Sure. Well, thank you, Jack. And again, thanks everybody for having me here today. It's interesting. I think every turnaround is a bit unique. And Drew, if we could have our second slide up there. I think every turnaround is a bit unique, right? But there are common elements that I've seen in turnarounds, and as I've studied other turnarounds, that seem to exist in almost all of them. And what I want to do, I don't want the slide to make you believe that a turnaround is simple. It's long, hard work, and it involves, and Dr. Scaringe will talk about the timing that's necessary for turnarounds and the pieces to it. But these elements, I think, are very important. I think first, board and senior management alignment is important. And when I talk about board and senior management alignment, I mean two things. The board and senior management have to be aligned on their roles. Boards govern, management teams manage. And so that governance and management has to be aligned. And then they have to be aligned on the plan. Every turnaround starts with some form of a plan. And as we all know with plans, the first thing that they do is fail at some level. So we need to be not only aligned on the plan, but the changes on the plan as we go along. Using the audit as a launch pad. The audit, the institutional audit and the institutional financial statements are critical. They are how many constituencies monitor us. They monitor us, our bondholders and our lenders look at those. The accrediting agencies look at those. Many other constituencies look at those. And the audit itself covers most of the financial details: revenue, expenses, assets, what we own, liabilities, what we owe, and most importantly, cash flow. And when an institution finds itself in a turnaround situation, cash flow is typically fairly critical. The other piece about the audit is when you use the audit as a launch pad, it helps you frame what should be goals. One of the things that we want to do in a turnaround is we want to look at where the institution should be financially in 3, 5, 7, 8 years. And so the financial goals in the audit are a bit of a North Star for us. Recent experiences with clients and lenders, the lenders want to see what the financial goals are for the institution. Breakdown of program margins. This is tough because in many higher ed institutions, the data systems aren't set in a way that give us useful and actionable financial information around program margins. So we need to be able to look at all of our academic programs, our non-academic programs, all of our auxiliary services, and many other pieces of the institution, and we need to know what each contributes or doesn't contribute to the margin of the school. Often fairly complex, but there are models for it, there are ways to do it, and so that the board and management knows really, the margin for each piece of our school. Legal policy and contract review, very, very important. In many cases, turnarounds will involve renegotiating contracts. I was on a board at a healthcare institution where we were considering a merger with another institution. And fortunately, one of our more senior trustees had said, we really should look at the documents, because this had been a city hospital. And when they split off many, many years prior, that original document said, sorry, you really can't merge with a private entity. So it guided us as to who we could and couldn't merge with. So a good legal policy and contract review. I'm sure Dr. Scaringe and others would agree. Turnarounds require hard decisions. And this is where the board and the management alignment is kind of critical, because these decisions are not going to be popular. They're going to have opposition at times. But if you've got your goals set, you've done your studies, you see where you need to go, the hard decisions are easier to put into place. Reallocation and capital investment. It's a difficult situation because in the face of a turnaround, you're normally trying to cut expenses, but turnarounds often require additional funds. They require additional professional services at times, legal, accounting, consulting services. They require analysis, and especially if you're going to be repositioning programs, taking perhaps a poorly performing program and making it work better based on what the market says, you may have to invest in that program. So you'll be, a lot of turnarounds. There's a strong effort to reallocate and make additional capital investments. A little bit difficult when I say re-examining and breaking compromises. We have to do things different. For various reasons, some controllable, some not controllable, we find ourselves in a position of not performing appropriately. So breaking compromises simply means we'll need to do some things differently. I can't tell you what those are. Those are very different for every institution. Jack mentioned my role at SNHU. SNHU was a marginally performing institution financially in a small market in New Hampshire. And what had to happen was we needed to really think differently about changing our delivery system, changing the way we offered courses to make the institution thrive. Just the last piece, a turnaround is 180 degrees, it's not 360. So I've seen institutions that have put consistent time and effort into a turnaround and things start to work. For various reasons, then they continue to turn and they spin back to their former financial positions. And I think it's important to recognize, and that's why ultimately we want to have not necessarily just financial goals, but non-financial goals, so that no matter what happens, we're actually moving towards those goals. So again, those of you that have done turnarounds may see other elements that are important, but these are 8 that I've seen and I use in the work that I do. Thanks, Jack.
Thank you, Bob. That was a very, very appreciative of kind of the overview and breaking it down in those 8 ways. I think before we transition and talk about SCU, Bob, could you talk to me a little bit about where do these begin, right? Like turnarounds are often talked about moving a giant ship in the ocean. You can't just spin that on a dime. What does that look like, and kind of where does a conversation like that begin?
Well, I think it begins in a candid conversation between the management team and the board, basically. In many cases, depending on, when I first perhaps examine or look at an institution that may be at some level troubled, I like to see what type of information is going on a routine basis to both management team and to the board. It does surprise me at times that folks on a management team may know an institution has some troubles, but the board may not. So typically it's to begin to align the board and the management team that this institution is facing some challenges. Those challenges may not be self-inflicted. They may strictly be, we all, hear about the enrollment cliff. They may strictly be market generated, but the board and the management team have to be aligned.
And I would just add that you really want the board and the management team to come up with this and not have your state. I mean, when I was running the higher ed commission, we had to go into some institutions and say, you're in trouble. And to reinforce Bob's point, sometimes they didn't understand that. There was not alignment and it was a problem. So yes, if an institution can get its act together before outside entities have to engage, that's a really good idea, both for the accreditor and the state agency.
Thank you, Catherine. And Jack, if I could just make one more point. I am noticing today, in today's environment, if we were to go back 20 years ago, it was not unusual for an institution to perhaps violate a debt covenant. And when they violated a debt covenant, they would speak with the lender, speak with the bond trustee, and there'd be a temporary waiver and, okay, don't do it again. It is a much different credit environment. So I have seen recently that creditors are coming in and saying, you have to do something now, and you're not going to get a waiver unless we have a plan. So just another reason.
No, I appreciate that. Clearly, a lot of external forces will play into this type of conversation. And I think, as you both pointed out, Catherine and Bob, board and management team alignment will be critical for navigating and having those initial conversations. John, I'd love to bring you into the conversation a little bit now and talk to us a little bit about SCU's turnaround. I mentioned during my introduction that you launched a 10-year turnaround plan in 2015. I was wondering if you could kind of walk us through that 3 phases and then talk to us a little bit about where you started with that, and what did year 1 look like in that process?
Well, thank you. Really appreciate it, and humbled to be part of this panel to at least tell our story. Um, the Southern California University of Health Sciences is a small, focused health science, institution, nonprofit, very tuition dependent. So I know that sounds like a lot of our small, institutions out there. When we experienced some back-to-back poor enrollment cycles at a college where we really just had 2 main academic programs at the time, I knew we couldn't patch our way, out of the challenges we faced. Things like, enrollment was declining, or strategic identity was unclear, or maybe not differentiated, enough to make us look different or be different than many of our, sister institutions. And our internal systems, and that's key, weren't built for growth. So we needed this runway, not just this rescue plan, as Bob was talking about. So that's why we built this. At the time it was 9 years. I extended a year on that in the transformation phase, but I like 3s. So I had 3 years in each phase, just to give us some structure. But I'm an academic. So what does academics do? They do their research. So I read every book that was on academic turnaround, chapters in books. I went into the dissertation and thesis database and took all these thesis and database on turnarounds. And I came across really Terry McTaggart's. He had this 3 phase, and I said, that speaks to me because I like 3s. So we institutionalized this transformational model where we talked about restoration, transformation, and positioning ourselves to be an industry leader in the health education space. So but there were 3 overarching systems to that too. The frame rests on these 3 interconnected systems that ensure long-term sustainability and transformation. And those 3 systems, how I looked at, was a strategic system, defining what we aspire to be, like our mission, our vision, our goals, institutional identity, growth and leadership. Those types of system. The operational system was defined, how can we execute change? The structures, the processes, the governance that enabled this disciplined performance and accountability. And then the third was our cultural system, define why people engage, right? We really needed to look at that. And this all takes time. It isn't going to happen overnight to have this sustainable change. So, we looked at our shared values, leadership behaviors, right? And trust that make sustained change possible. And building that trust takes time because people have to see the results. So maybe we can put up slide 2 really quick here. So the 3 phases, basically each phase of the model has its own flavor, pace and purpose, basically. So if you see that restoration, it was to assess and repair these critical faults to position us for future growth and transformation. And that was really a discovery type of phase. We brought in consultants to help look. So we began with stability. Our immediate priorities were to stabilize finances through our budget discipline and targeted cuts, Rebuild transparency, communication, communication, communication. Um, Restructure our operations, you know, to simplify our decision making. And Bob talked about, you know, your working together with your board. And then strengthen that accountability so you're all on the same page, and then invest strategically in the future growth. Um, we were backed by our board. They supported us through some temporary line of credit expansion. They knew it was going to cost, and they were like, "We're going to help you through these 2 to 3 years to get you back into the black and rebuild internally." So we were back in the black within 3 years and repaid the credit line probably all the way, you know, in year four, by year four. So that early win restored a lot of confidence internally and externally, you know, establishing that foundation for disciplined, forward-facing, you know, leadership. Phase two, transformation. Once stable, we shifted to transforming our institution, expanding from survival to growth. So key priorities included defining our strategic identity, almost moving more external as well. You know, we looked internal, and then the second phase tended to be a little bit more, while we continue to transform internally, obviously we had an external presence. So we expanded our academic programs. We started to have this infrastructure where we can expand to diversify our enrollments and the revenue. So we invested in technology, business processes, you know, to support scaling, building leadership capacity across all levels of the institution. So transformation required this new mindset, you know, as much as new systems. So we focused on, you know, developing our leaders who could, you know, operate in ambiguity and make data informed decisions. And we're still working on that, you know, getting better data, quicker data, so that we can make, you know, quicker and more informed decisions. And we aligned everyone's work to the institutional, you know, purpose. So we're, you know, we're in, you know, kind of like that third phase, this final phase, focusing on positioning SU as a recognized leader. So we want to differentiate the institution, strengthen partnerships with other institutions, health systems, research institutions, elevate our brand and influence and reputation, and institutionalize a culture of excellence and continuous improvement. So this phase has been, you know, all about sustainability and ensuring our systems, people, and culture really, you know, can outlast any one leader or leadership team. So, you know, I guess I can end there if you want to put the slide down, and I can get into, you know, maybe change management later, because we think that was a key component to, you know, how we turn this around as well.
I appreciate the overview. I love the three phases. I'm also
I'm not. Can you say that again?
Oh,
My
you're so fun. I was just saying I appreciate the overview, and I'm a sucker for threes as well. So I like the breaking down and the 3 years per three phases. I really appreciated that. I think one of the things that stuck out to me, especially from phase one to phase two, is you talked about the shift of culture and the shift from looking internally to externally. Could you talk a little bit more maybe about that change management style, and talk to a little bit more about how you onboarded new people into a culture that was kind of evolving and changing?
Yeah. I guess, you know, my philosophy is, you know, management is a noble position, right? You're not there for regulations and processes and, you know, sticklers. You're there to develop people, and every manager should have a good grasp of what change management is. So, you know, management is change management. So change just isn't strategic, it's human. right? And people naturally resist change. So especially when it's challenges that what they maybe built and how they've worked is going to change because they're passionately attached to that work. So really, for any type of transformation to stick, not just tinkering with transformation, but true transformation, um, I leaned heavily on a change model. I used Bacharach I think out of Cornell, which emphasizes alignment across four essential elements. So strategy, a clear, compelling direction and why change is necessary, never, um, uh, um, you know, really looking at your mission, vision, values, but who you are. Structure, so there, Bob talked about this already, governance, roles and the systems that support this way of operating. You need the systems to complement each other. You can't have a reward system that, isn't, with the changes you're looking to make, with your evaluation, right? And appraisal system. That reward system all needs to support each other. And then culture, shared values, behaviors, and things like that that sustain, engagement and trust. And then the processes, consistent methods for planning, communicating, etc. So if one of those elements are misaligned, the change efforts will stall. And with Bacharach, it's all about momentum. So, keep the momentum going. Um, so that communication early, and often invite dissent, to surface real concerns so that you can address them. And Bob said this, you got to act decisively, um, because hesitation is often more damaging than mistakes themselves. So you need to balance that structure. Empathy, became a defining, feature of our leadership culture. And by building that runway rather than, rescuing, we were fortunate to transform a vulnerable two-program college to, this growing, diversified university, positioning ourselves in this whole health education. So um, I don't know if that answered a little bit on the change management. Any change management model. We just use one. They tend to, have a lot of common threads to them. Just pick one and, give some structure to your change management strategy.
Did you have a lot of turnover, John, in that 10-year
Yeah,
process, given the change of the
you,
culture? And
you know, Bob, that's a great question. Bob, mentioned about the tough decisions. Yeah, it was hard. And in that first phase, we were figuring things out, right? I had a lot of consultants come in. I had, financial consultants come in. I had IT consultants come in to help, how are we going to do this? We started looking at different divisions and departments with their processes and their business processes, right? So we were gathering a lot of this information. And we did have to lay off some people who were dedicated friends, these people you've um, uh, had some really connection with. And there was some confusion, no matter how much you communicated and say, we're going to be making these changes, that we were laying people off and hiring different people at the same time because we were positioning ourselves for change, bringing experience in from the outside to help us, with that knowledge and experience. And those were the toughest decisions I made in that, really that first phase, really launching into that transformation on year like three and four. But since then, the people that are leaving are leaving to advance their, professional goals. We have people that aren't leaving. They're just committed. So yes, in the beginning, we're not seeing it now. We're attracting people that really, buy into our mission and vision, and we're just very fortunate to the individuals that are attracted to the institution.
Which and shows that the hard work you put in during those 3 and 4 years early, you laid a fantastic foundation and great groundwork. Bob, you were one of the consultants that was brought in at that time to help with some of the finances. Can you talk a little bit about your experience being brought in at the beginning of a turnaround, kind of what the communication strategy looked like and what that experience was like?
Yeah, well, I think, Dr. Scaringe and I go way back, and some of my initial work was even turnaround. And it was trying to assess the financial condition of the school. But initially, it was designed to see if, on the finance perspective, if the right people were in the right places. It was also to look at the balance sheet a little bit and to see if there were extra assets that could be leveraged to support the growth and the restructuring of the institution. And then I think the other piece along the way, and John, I don't know if you'd agree with me or not, it seemed that you took a positive approach towards trial and error on a few things. You looked at different ideas with mergers and acquisitions. You looked at different ideas with new programs. Some of them panned out, some of them didn't, but there was always a culture of looking at doing things new and differently.
I would agree with that. I mean, I'd say at least 7 years, we've, been looking externally at, mergers, acquisitions, being part of the nonprofit systems, joint ventures with for-profits, nonprofits. We, looked at them all, and it is, 7 years of trial and error, as Bob said, and we just landed an acquisition that'll pick up 2 locations and about 650 students. So
Wow.
we're looking to close that in May. We got the shutdown with the Department of Education now, so who knows if that'll happen in May or not. But we'll continue to move with that acquisition. So.
And then, John, throughout kind of phase 2, you talked about adding different types of programs and trying to expand a little bit more. Can you talk about your relationship with your accreditor, WASC, what that looked like, and what that communication pattern with them was like?
Yes, very important. I've been deeply involved in accreditation for years, not just at SCU, but as a commissioner for the Northwest Commission, peer reviewer, site team visitor, and I still chair. About my time only allows me about 2 visits a year. So it's easy for me to see accreditation as a I think others can easily see, accreditation as a compliance exercise, but I've come to see it more as a leadership opportunity. It forces you to, assess really what matters. It reveals your blind spots. It challenges you to prove your impact, not just your intent. And at SCU, we've used accreditation to improve systems, reinforce our mission, align, really our strategy with execution. So done right, it builds credibility, not just with the regulators, but within your own team and campus, right? The process really, builds that credibility and shapes, this growth mentality as well, or the culture that is led. So we work proactively with WASP. I reached out early, and I continue to reach out early, set regular check-ins. invited them into the process, and they appreciate it. They don't like surprises, you know. Accreditation just wasn't, you know, a hoop to jump through. It became for us a lever to drive our quality systems, internal accountability. So we use standards as a guide, not as a hurdle. So that's how we approached it. And I'm really interested to hear, you know, Catherine's you know, perspective on that as well.
Well, I think we should take what you just said and codify it and get it out to the world, because creditors dream a perspective from an institution like that. It's just, I mean, those are all the things. You cannot be proactive enough with the creditors, and they're going through a lot of changes now too. And I know I work very closely with New England NETCHI, it's called now, and Barbara Brittingham,
Right.
you lead it. You would always say, I go by the SRP program. And I said, what's the SRP program? Surprise Reduction Program. So you just really spoke very well, and you articulated the goals that every accreditor has. As we know, accreditors are about quality assurance, and states are about consumer protection. And I'm
Right.
wondering what you saw in terms of distinctions in your interactions with those groups, and how you managed it. I know in New Hampshire, we're really lean, so we depended on our accreditors, and the state would really just hop on that process because we didn't have a lot of resources. But I'm wondering how you managed that in California.
Well, as a health, you know, as a healthcare institution, you know, we also work with all the state boards of the programs that we offer, all the different disciplines. So there's that consumer lens you're looking at, as you mentioned, and then with the accreditation, it's the student lens, right, that we're all looking at with that. So, you know, I think depending on which regulator you're working with, you know, how do you communicate with them and ask for, everybody likes to be asked to be helpful. At least that's what I've found. So, you know, ask for their help, and it also helped us know how to construct our reports and things like that, not just internally, but the externally, right? To get the things that you need, right? But I don't know if I answered your question. You know, California's a very heavy regulated state in all areas. I think people tend to, you know, throw their hands up. Oh, what can we do? It's, you know, you can't, you know, do much. But you got to be persistent and look for ways and be patient with time, you know. But I thought we worked really, really well with WASC, and
That's great.
they always seem to be very helpful for us.
That's great. Jack, I hope we have this recorded. This would
Yes,
be,
ma'am.
it's a great model. Thank you, John.
Yeah. One thing that came up a little bit earlier in our conversation is morale. And I was wondering, Bob, if you could talk a little bit about, from kind of a board perspective, and then John from an on-campus perspective, what managing morale throughout this process looks like, especially with kind of that hard decisions that we were talking about.
Sure. I think, you know, when a board and management team are aligned on, you know, number one, the need for a turnaround, and then number two, what the, you know, plan is, and then, you know, number three, that they're in the appropriate governance and management roles. I think there's a joint sense of doing the right thing, not only for the institution, but for the people that are there at the institution. Morale is important. I think John's institution is still one of the top institutions to work for in terms of national surveys. And ultimately, your staff respects the hard decisions that you have to make if they're thought through, if they're fair, and they're executed with a sense of purpose and a sense of justice, if you will. So I think morale is important. I also think, on a little bit of a sidetrack, I also think board training is important. I think it's important for boards to understand what accreditation is. They need to know the standards that the institution has to, adhere to and use as, in a sense, I used to use accrediting standards as business plan guidelines. Every document I wrote for my business plan for my institutions was framed with accrediting standards. So I think the training of the board and appropriately looking at the right staffing models is critical.
I just want to reinforce, Bob, your point about I did my dissertation on the organizational entry process for new college presidents, and I was shocked at how little the new presidents understood about the finances of the institution that they just took over. And I mean, I think some boards think that's the turnaround, is just to hire a new president, and that is so wrong. And I'm glad to hear you articulate there is a way for the board to align with the senior management. And I think that's worth the effort to put into, because that communication doesn't always happen and the training is essential.
Well, I think also the issue of the structure, orientation, and training of the board is critical. High-performing boards know the higher ed industry, if you will. They have routine sessions. I've been at institutions where every board meeting started with an open forum where the board was oriented into something about higher education.
Nice.
And I think it's really important that boards understand their fiduciary responsibility to the institution. It's not unusual that many boards have, significant alums on the board. And, alums tend to see the institution through the lens of their own experience. And that experience may have been 20 years prior or even longer.
Yes.
And
Right.
the industry changes.
Yeah.
And so boards have to be brought into the current industry standards and industry condition.
Yeah. That gets to morale, right? To your question, Jack, if you pay attention to those things.
100%. Yeah. And John, shifting a little bit more to an on-campus or inside the institution lens, throughout those tough decisions, what did you do to maintain morale and kind of communicate those tough decisions?
Yeah, great question. I'm sure there's multiple ways to approach it. We looked at it as, I guess the easiest answer to your question is, we maintain morale with visibility and communication. I held town halls in the beginning. They were more frequent. Okay. We had updates weekly, whether it was through communication, through an email, or live. I made myself available. I truly, had an open door policy and took every, student that wanted to see me, staff, faculty member, and arranged a meeting. And we did other tactical things with that. At every in the beginning, monthly, I would put up, 3 years, 3 phases, and I would have this line graph of where we are financially.
Wow.
And where our projections were going, right? And I would overlay that on the slide. Here's our finances, right? And here's what our goals were, and here's how, maybe a red line and a blue line, right? And I'm going to say, damn, if it didn't really match up well. So people see that there's a plan. They're seeing how the finances, are overlaid over that plan. And now it's like, oh, okay, we're doing exactly what we said we're going to do. We also had our KPIs dashboard, key things with us. And every computer, we would push it every term, what our KPIs were on this traffic light dashboard, whether we were green, yellow, or red. and that was on everyone's computer before they logged in. So they were seeing what was important for us as we went through. So I think in the beginning, it took some time for that trust to happen, and how they're a part of, something bigger, and that what they're doing makes a difference. It's hard for individuals to stay motivated when they're working so hard and the finances are still in the red. It's like, what the heck's going on here? But as soon as they're seeing, okay, I'm putting all this work in and there's progress and it's something that they can be proud of, it takes time. It doesn't happen overnight.
Yeah. No, I appreciate that. And kind of in that morale and transparency lens, Bob, in your article and your blog, you talk about compromises, right? And there's institutions make a lot of compromises, and often turnarounds include, as John said, tough decisions and breaking some of those compromises. Can you talk a little bit about compromises that institutions typically have to break through times like this, and what a turnaround means for kind of the current status quo?
Sure. That thinking of, on compromises is attributed to Michael Porter at the Harvard Business School, who, in his theories suggests that every industry, every business has compromise with its customers and its clients. And those compromises, in order for an institution to change, and especially in a turnaround, some of those compromises have to change. So those compromises are different at every institution, and they're different in every industry. Give you a simple example. I was speaking with a client recently. One thing that became obvious was that their real estate is used really inefficiently, really inefficiently. And in order to improve the efficiency of it, they had to change their scheduling system, which was predominantly driven by the faculty at the time. And it had evolved over the years that the faculty controlled the class scheduling, they controlled the use of the labs, they controlled what rooms got used and what buildings got used, and what time the courses were. So at times, if a faculty member wanted to teach a course at 8 o'clock at night, that building may stay open an extra 4 hours simply to have that hour-and-a-half class. So that was the compromise. The president, working with the faculty senate, ultimately was able to kind of restructure what those compromises were. It wasn't easy. And I mentioned, reviewing legal documents. It ultimately had to, result in a change in the faculty documentation, faculty contract. But changing that compromise on a more, larger scale, institutions that were classroom-based and have effectively then, the compromise was you come to the school and we teach you here, you go home. Well, now the compromise is we build the course with technology and we deliver it and you take it wherever and whenever you want. So I think examining the compromises is really important because there typically does need to be change in those compromises.
That's awesome. And I appreciate that insight. And thank you, Michael Porter, for that framework.
Yeah, I'm assuming that the reason that works is because everything is consistent with the stated mission for the organization. And when you have to break a compromise, there's something larger that the organization, that the leadership is saying, and that's because blank is consistent with our mission. Yes? And I'm wondering if each of you can just say how your mission has fit into all of this. If that's okay, Jack.
Yeah.
I'll just quickly, before John weighs in, I always am cautious. The institution's mission is important. And, all institutions have mission and vision statements, but it's very easy for things to fall or be described as under a mission for an institution. So I encourage board members especially to go back and look at the original and chartering documents for the institution to see why it was initially founded. And has it drifted significantly over the years to a different mission? So it's not that the mission isn't important, it is, but we want to make sure we're around in 25 years to continue to have a mission.
And I'm sure,
No margin, no mission, as the old
right,
expression
right.
goes, you know?
Well, and accreditors and states appreciate that too. I
Right.
mean, that's so important. Yeah, yeah.
Well, I'll answer it in that, our mission, we're a service institution. We're providing education to students and preparing professionals in healthcare. We're not in existence to employ people. That's not our mission. Our mission is to train and prepare these healthcare practitioners of the future. So you need to always come back to those students and the student needs. And, faculty, staff are there, to provide this service to our students. And ultimately, our patients, because we also have a healthcare delivery at the institute. So we're preparing our students to provide a service to their communities on the health of their community. So that's what we always went back to. So I don't know if that answers your question, but
Thank you.
Yeah.
Good,
We
thank you.
actually have a question in the chat box, and it is for Bob. Before I get to it, if any participants have a question, we're happy to take it with about 6 minutes left in the webinar. But Bob, somebody would like to know kind of what causes that backslide from 180 degrees back to maybe 360. What are some common pitfalls leaders and boards might fall into?
I think a few things. Number one is it's not uncommon that a turnaround plan has a specific list of goals and objectives and things to do. And that needs to be continually monitored and assessed, trial, error, see what's working, see what's not working. I think one of the primary problems is that institutions don't ultimately use the financial metrics and the quality metrics as kind of the North Star. So I was on a hospital board many years ago where the institution was struggling a bit, a small community hospital. We had a new CEO, come in, and he said to the board, he said, how much should we have to make every year? What should our margin be? And the board, working with the CEO, came up with a consensus margin that some years was higher, some years was lower. But as the turnaround for the hospital continued, we're always looking at that margin. So I think having those goals, and those goals don't necessarily always, of course, have to be financial. They can be quality goals, they can be mission-related goals, but they have to show and continue to point the institution towards its financial stability.
Yeah. And I'm reminded in your answer something that you stress also when we work with our partner institutions of SMART goals and trying to have them, you need to be able to quantify them. So assigning them a KPI or some type of metric that even if they're not financial or numbers driven, still being able to measure them and say, did we hit our mark? Going back to John's red, green, yellow, red, yellow, green. Are we in the green? Are we in the yellow? Are we in the red? And where are we with those goals? I love that. I appreciate that.
Well, it's interesting too, because recently we had a conversation in the last, I don't know, year or so with the board that, we had these KPIs up there and, meeting the budget or meet or exceed the budget gets you, green, blah, 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 within, your enrollments, your board scores, right? Accreditation, reports and things like that, with all your programs. And there was too many greens, I think, for our board. So they were like, well, wait a minute, we need to like relook at some of the, criteria here. So, financially, we did. We went back in and came up with a more specific KPIs under the dashboard, obviously, and started to use those as well. So
Yeah.
interesting.
And KPIs, for those unfamiliar, are key performance indicators. Just want to make
Yes.
sure
Yeah,
we're all on the
sorry
same
about
page.
that.
No, you are so fine.
Okay.
We have another question in the chat box, and I'll throw this out to anyone that would like to answer it. It's, how does the turnaround plan work with the existing institutional strategic plan? Does it replace it for a season? Does it partner with it? What does that kind of look like?
Can you say that again?
Yeah. How
Yeah.
does the turnaround plan work with the institutional strategic plan? Does it replace it for a season? Does it work with it? What does that look like?
I can answer that from our perspective. I had, those broad categories and flavors, right? The three phases. And I'll give an example. For our first phase, restoration, we had a couple years left on our strategic plan, right? That was there. Well, a lot of that went out the window as soon as like our enrollments were down. We started looking at, what we needed to do. And we were, investigating, right? But also looking financially what we need to do. And like Bob said, we needed to start coming up with a plan. So year one, we're really looking at, okay, what do we need to do? How do we move forward with this? Came up with this three-phase, plan, and we had our strategic plan, which we, shifted some of the goals that we needed to and objectives that we needed on that. So by year two of that restoration, we were then going through the process, or year three, we were going through the process of a new strategic plan, right? That we started, that now we had the framework of the transformation and industry leader phase, right? That to build it about. So it kind of overlays that, right? And we just, we're in our 2 years of another strategic plan, which really looked at that industry leader piece. So our strategic plan became, okay, here's our major goals that fit into these this turnaround phases. And then every year we would have our priority goals, annual goals, that matched up somewhere to those 4 goals of the strategic plan. And the strategic plan was written with some flexibility in it as well, and not real hard key performance indicators, but that's how we did it.
Yeah. I know we're coming up on time, but Bob or Catherine, any other words of wisdom with strategic plan matching up with the turnaround plan?
I think your strategic plan helps you get to your strategic position, and the turnaround plan helps you stay within the parameters of making sure you get there, whether it's 3 or 5 years or 7 years.
Yes, that makes perfect sense. Awesome. Well, we are at the top of the hour. I want to thank everyone who joined us as a participant. Thank you so much for your time today. If you're on the East Coast, thank you for your lunch hour. If you're on the West Coast, thank you for your morning hour. A special thank you to John Scringe once again, Dr. John Scringe, for joining us this morning. And thank you, Bob and Catherine, for your wonderful expertise and words of wisdom as always. Thank you all so much. Feel free to subscribe to Stephen Strategy's newsletter and follow us on LinkedIn for more insights and tips just like this one. Thank you all again, and I hope you have a great rest of your day.